I'm going to be introducing the session called Seeing a Better Tomorrow, Know Your Risk for Diabetic-Related Eye Disease. Diabetic eye disease, particularly diabetic retinopathy, is the leading cause of new cases of legal blindness in people 20 to 74 years of age in the United States. The prevalence and rate of diabetes in this age group is even higher in Blacks than in whites. Today, we're going to learn to modify risk factors and become informed. Please join me in welcoming Director of Retina Service and Surgery at Cizik Eye Clinic, Dr. Garvin Davis, and Principal in the Patient Inclusion and Health Equity Team in the Chief Diversity Office at Genentech, Veronica Sandoval, PhD. Please join me in extending a hearty welcome.
Well, good morning, everyone. Thank you for making time and joining us in this important session today. I am Veronica Sandoval from Genentech, from the Chief Diversity Office. We are very happy to have a great panel this morning for you. We have Dr. Garvin Davis, and I want to make a correction. He is actually now with the Houston Methodist Eye Associates, where he is a retinal surgeon. And he is a wealth of knowledge in talking about what is diabetic eye disease and what are the risks that you should be watching as patients, as your family members come to you and talk about taking care of their diabetes, but not forgetting about their eyes. And then we have the pleasure also of having a patient from Dr. Davis's clinic, Flora, with us this morning to talk about her journey with diabetic eye disease and really tell us her perspective of how it is that you go through a diagnosis, treatments, and how do you make sure that you're taking care of your eyes. Without further ado, I want to turn the stage over to Dr. Davis.
Hey, thank you very much, Veronica, for that nice introduction. Thank you for inviting me. It's a pleasure to speak to Black Health Matters. I'm going to start by just showing you a little bit about what things look like in the eye when diabetes starts to affect your vision. So let's take a closer look. So here's what we're going to do. First, we're going to talk about just how bad a problem it is. I'm going to show you some pictures and give you a great understanding about how the diabetes affects your eye. And then I'm going to tell you what you can do to prevent eye disease. Unlike kidney disease, this is a modifiable factor and something that you can actually do. So, and I'm going to repeat it multiple times, so bear with me because I believe in just important points, you really knowing what you can do. So yeah, let's take a closer look. You can't see your own eye. Okay, so first let's talk about diabetes. You've heard that that diabetes is a leading cause of blindness in working age people between 20 and 74. So there are two types, type 1, type 2. Most people have type 2. I want to leave some time for Flora. So I'll go through this quickly, and it's mostly going to be a show and tell. So 9.4% of the US population actually has diabetes. So that's a lot of people. And what's really interesting about eye disease is that there are several things that blind people. However, diabetes is the leading cause of preventable blindness. So it's something that we can actually make better. And you might wonder, well, why is Veronica here with Genentech? Well, so back when I started training, we didn't have great treatments, but their company actually produces one of the major drugs that help us actually prevent blindness in patients. Forward slide, please. So what does it look like? Okay, so after 20 years, 28% of the population has diabetic, what we call macular edema. So let's just talk about the eye. So the eye is like a camera. Light comes in, it gets focused by the lens, just like a camera, and then it goes to the back of the eye, which is the retina, which is like the film of the camera. So this is what you can do. You don't want to be this guy. You don't want to beat anorexia. So what you want to do is keep your hemoglobin A1C less than 7. You want to have blood pressure control weight loss, exercise, and yearly visits to your ophthalmologist or your retina specialist. So I'm really excited. My buddy Gary Shepard is going to be talking to you after lunch, and he's going to tell you exactly what you can do with your diabetes, but to get your hemoglobin A1C low. But here's what I just want to emphasize, and that's why I put it on this slide 3 times. Every diabetic patient must be seen by an ophthalmologist at least once a year. Now, what's an ophthalmologist? People get confused. So what's the difference between an optometrist and an ophthalmologist? Well, it has to do with the level of training. All ophthalmologists actually go to medical school. Your ophthalmologist could be any type of doctor they wanted. They could be a neurosurgeon, but they chose to be a retina surgeon or an ophthalmologist. We treat eye disease. Optometrists give you glasses. If you come to me, I will dilate you, see the back of your eye, and if you want glasses, I will send you to an optometrist. So this is we examining a patient. We look in the back of the eye very carefully. I'm really proud of this patient because actually I grew up with her. She's now, I think, about 90, and we could see, like, our backyards growing up in Louisiana kind of abutted each other, and we used to mow her lawn when I was a little boy. So this is what the back of the eye looks like when it's normal. And this is what it starts to look like with eye disease. So you can see that little black spot in the very middle. That's what gets you your fine vision. This is what it starts to look like when disease starts to affect the eye. Now, there's a progression in eye disease. And so you start off having mild eye disease, then you go to moderate. Okay, and you can see here, there are those yellow spots next to the black spot in the center that I was showing you. So that is the macular edema that we're talking about. And that's what starts to cause decrease in vision. This is another picture of what it looks like when we look in the back of the eye. And as I talked about, it progresses. But again, here's the key slide, what you can do. You will see this slide about 4 times because I want you to leave this talk knowing what you can do. I think it's very depressing to see all the bad things and talk about blindness and not talk about what you can do. So with proliferative diabetic retinopathy, the eye starts to bleed. And you can see these new blood vessels. Here, I'll go back quickly. You can see this is normal again. See how the little white spot on the left looks nice and clear, and you don't see a lot of blood vessels. But here, you start to see a lot of blood vessels growing at the nerve. And then when I get involved, when I start doing surgery, is when the eye really starts to bleed. And you can see, again, you saw normal. So this patient will probably be about 2,200, 2,400, because you can see the blood just blocks the very center of both that black spot that I was showing you and the nerve. And so this has to be repaired surgically. Again, you want to prevent this. So this is a really bad, so this patient will probably be like count fingers again. You know what normal looks like. My job is just pattern recognition. You've seen normal, now you see what happens is the blood vessels start to regress, you start having fibrosis and scar tissue, and this patient will this will be a very difficult surgery. And this patient probably, at this point, this person probably won't see very well, even with surgery. So, again, these are other ways that we look at the eye. So with macular edema, this is a cross-section of the eye. So if you're looking at how thick the retina is, this is what normal looks like. Again, a nice foveal contour, a little valley. When you have diabetic retinopathy, you get this swelling in the eye, and this person, again, will have decreased vision. So this is just a slide showing you the progression. What do we do for this? So we laser, we do eye injections, and ultimately we can do surgery if necessary. I didn't bring a lot of slides showing you about that because I want to leave some time to just have a patient experience and know what you can and cannot do. Interestingly, I'll share with you, since Flora is here, it's not a HIPAA violation, but she's had all of this in her eye, and she can tell you all about it. This is what, by the time diabetes starts affecting your vision, I'd rather get to you before that. I'd rather see you early and prevent this. I'm a big proponent of preventable blindness. And I know it's difficult, so I put this slide up to show you just how much time it takes to take care of your diabetes. So it seems a little busy, but here's the point. This is how much time you're spending with each physician, and these are all the different physicians that you need to see with your diabetes. And so it's a treatment burden. If you have to see your nephrologist, you may have to see your PCP, your endocrinologist, but I don't want you to miss your ophthalmologist. It's one of the most important, if not the most important person that you see, so take some time to come see us. And again, what can you do? Your hemoglobin A1C less than 7. You have to control your blood pressure as well. It's not okay just to control your hemoglobin A1C because high blood pressure also leads to a problem. Weight loss, we always talk about. There are talks today about that. Exercise, if you can, and please come see your ophthalmologist. So with that, let's talk to Flora a little bit.
Good morning. My name is Flora, and I'm a patient of Dr. Davis. I started seeing Dr. Davis right after I gave birth to my son. I remember I was in a hospital after I gave birth. I had a C-section and everything. And, the next day they come in, they check on you, and I told the nurse I couldn't see. I said, she was like, oh, it's the Pitocin. It'll come back. Don't worry. And so I was like, okay. I went home. I still couldn't see. It was blurry. It was very blurry. And I've been diabetic since I was 13 or so. I never saw an eye doctor. I never had the need to see the eye doctor. I was like, I can see. There's nothing wrong, So after I gave birth, that's when I knew that I was having really bad eye problems. I went to the emergency room, and they said they couldn't help me, that I needed to see an ophthalmologist. I said, what is that? I know the optometrist, but I don't know an ophthalmologist. So I was referred to Dr. Davis. So I went there, and he told me that I had a lot of bleeding behind my eye and that my retina had detached. And I was confused because I was like, is this from pushing a baby? Because I didn't push one. They had to cut me open. And he was like, no, it's from your diabetes and everything like that. And, I was shocked. I was scared. I was like, am I never going to see again? Luckily, I was able to gain vision back in my eye. Then I developed cataracts, so we had to go through surgery for that again. It's been a journey, Like they said, originally he was with Cizik, and when I heard that he was gone, I was like, oh no, I have to find him because he's the only man I trust when it comes to my eyes, So I make sure that I see him at least once a year. I mean, there was a point I was seeing him. I felt like I was seeing him almost every other week because, he was trying to get my vision back. So as a diabetic patient, it is very important that you do see your eye doctor. You don't want to wait till you have extreme pain in your eye or you have blurry vision or anything like that, thinking that glasses can fix it when in the situation you have bleeding behind your eye or you have swelling going on and you don't know about it because honestly, there's no pain. There's nothing there. It's just, one day you wake up and you have blurry vision. You're just thinking, it's old age or it's, genetics or anything. No, if you know you're diabetic, please see your ophthalmologist. It's very important.
Thank you, Flora.
You don't have to be where I'm at today. I see Dr. Davis at least twice a year now just to make sure everything's okay. Your eye pressure is also very important. So see your doctor. See Dr. Davis. He's really good.
Thank you, Flora. It's not a
Yeah.
public service announcement. So Flora brings up an important point that I forgot to mention. If you're diabetic and you become pregnant, you really need to see your ophthalmologist because the vascular changes that happen during pregnancy can affect the eye. And so we usually like to see you in the first trimester, and then if we see any diabetic eye disease, then we want to see you again in the third trimester to make sure that you haven't progressed. So that's a very important point. Thanks for bringing that up.
Well, thank you, Flora. Thank you, Dr. Davis. We want to open the floor for questions. And as we're waiting for questions, I just want to ask Dr. Davis, you had your 3 key things of takeaway, the A1C, blood pressure, exercise. Is there anything else that you want to tell the audience that you want them to remember from your talk today?
No, those are the big ones. I mean, I think that the most important thing, and I've threatened to, I threatened to do this for my patients in my clinic. I ask every patient what their hemoglobin A1C is. And you may say, okay, what is that? If you don't know what that is a measure of how well you're doing with your diabetes. Everyone knows, okay, check your finger stick, and this is what your blood glucose is at a certain point. But the hemoglobin A1C tells us how you've been doing for the last 3 months, and that is very important. You need to know it, like you need to ask your doctor about it. Your doctor should tell you about it, and it should be less than 7. And what I've threatened to do is like put a list of everyone's hemoglobin A1C D-class, no names, but give a prize to the person that comes to my clinic that day with the best hemoglobin A1C, because that is the key. I tell my patients, hey, put me out of business. I'd much rather prevent eye disease because you've controlled your diabetes than to watch someone go blind because of poor control. That's heartbreaking. And I have patients that can't see at all in either eye because of, just not knowing about disease. And some of them are really young, like 22, 23. And so that's the most important thing, the hemoglobin A1C. But we have great treatments now, too. But the problem is the treatments are treatments and not cures. So Flora's had injections in her eye, which is just like, and you might say, what do you mean injections in her eye? Well, just like you get a shot in your arm, we actually put a needle through the eye and inject medicine in. It sounds worse than it actually is. I always tell patients, I think it's, they're like, what, you're going to stick a needle in my eye? I was like, okay, you must have made lots of promises when you were a little kid. Cross my heart, hope to die, stick a needle in my eye. You would feel just as scared if I was like, we should change that nursery or a little kid saying to say, stick a needle in my toe or something. Because now we stick a needle in the eye all the time. It went from like we didn't have it at all to now it's the most commonly done medical procedure in all of medicine.
On that note, having those injections being done in the eye, I would like to ask Flora, if you could share a little bit with the audience, what is your experience with having injections?
I remember when he told me he was going to stick a needle in my eye, and I was scared because a needle, I was like, wait, wait a minute. But it wasn't bad. When you come into the office, they numb your eyes. I mean, you can still see with it and everything. He'll come and ask you. He'll stick the needle in your eye. It's a really quick process, and he'll ask you how many fingers is he holding up. As long as you can tell him that if he's holding up 3 fingers, and you can say 3, you're good to go. I've never experienced anything outside of that, so I don't know any bad side effects of it. But it's not a bad experience at all.
Mm-hmm.
It's not a bad experience at all. It's not a thick needle or anything like that. It's very small, goes in, goes out, and that's it. I kind of use it as horror stories to, scare my friends sometimes. I'm like, don't let them stick a needle in your eye, so get it together. But yeah, it's not a bad experience, but it's not something you want to experience either. If you can prevent it. So yeah.
Okay.
Any questions from the audience?
Yes.
Yes.
Hello to all. To the doctor from Louisiana, hello.
Hi.
Hi.
How are you?
What's the perfect number that you would like to see the AC1? What's the perfect number that you would?
So, I would work in conjunction with your primary care doctor to figure out what the goal is for you. Typically, we say less than 7 is ideal. And, less than like 5 or so, you're not really diabetic. I've seen diabetics do really well and control their blood sugars where their hemoglobin A1Cs are in the 5s, but usually they're between, 6 and 7 is ideal.
Hi, good morning.
Morning.
My question is really about those that fall into the pre-diabetic range and the prevalence of vision loss with pre-diabetics and sort of like what your recommendation would be in terms of ophthalmology visits for those people?
Oh, the same. Come see an
Okay.
ophthalmologist per year. I mean, when you're I mean, even if you don't have diabetes, you have high blood pressure, you have cataracts. People after the age of 40 should see an ophthalmologist at least once a year.
Thank you.
Hi, would it be possible for you to use a microphone, or can someone bring the microphone over? Yes. Someone is bringing a microphone.
Oh, there's a lady right here. Here, I can walk down. What's your question?
Yeah, come to this
I
one.
can bring you a microphone. Okay, all right. Someone's faster than me.
Okay. I have a retina problem, but I was never diagnosed as diabetic or an alcoholic. So what happened to me?
Oh, it's hard to say without looking at your retina. I mean,
Okay.
don't get me wrong. Like it takes 2 years to train to be a retina specialist after the 3 years of just being a general ophthalmologist. So there's several things that affect the retina. The leading cause, so it could be macular degeneration. You could have had a stroke in your eye. People have retinal detachments. Diabetes is just one of the things that can cause a problem. It's one of the things that's near and dear to my heart because it's something that we can actually prevent and make better. But there's several things.
Okay. Thank you.
But I can tell you what happened. I will do an advertising here. Come see me. I'll tell you what happened.
Okay.
Do you have a question?
Yes. Is there a relationship between statins, so many diabetics are on a statin, and eye disease? Do you know of any relation there at all? Or?
Yeah. So I guess the question would be, does controlling your cholesterol affect diabetic eye disease? Not that we know of. Is that
No.
in terms of the statins themselves? Not that I'm aware of. No. It's mostly just blood sugar control. That we've tried several studies, like does aspirin make a difference? And so we haven't found that anything really makes a difference more than just controlling your blood sugar and your blood pressure.
Well, I see that our time is up, but I would love to encourage everyone. Dr. Davis is going to be around. Flora is going to be around. Please come and speak to them. Continue the conversation. And remember, please check your eyes. Please, let's give a round of applause to both Dr. Davis and Flora for today's panel. Thank you, everyone.
Thank you.